So I think I ought to ask my North Carolina question first. My district shares a border with North Carolina. Mr. Weisky, you indicated earlier in answering one of the questions that there were some issues around the borders. Could you tell me what was going on there and how that affected you all?
Sure. I mean, I think when you're dealing with the exchange and the subsidy market, it sort of shut down the sort of, moving between the borders that happened, that those borders became a little bit harder than they were before. And so because you're on one exchange versus another exchange, it wasn't just buying health insurance, that became an issue.
And let me ask you if you ran into any of the problems in your state that I ran into with constituents when it was first rolled out. I had folks who were going to medical facilities because my district is the corner of Virginia, so I border North Carolina, Tennessee, Kentucky, and West Virginia. And so one of the things that popped up almost immediately was, and it was particularly a North Carolina situation, I had a constituent who was receiving cancer treatment in Winston-Salem. It might have been Duke, but I'm pretty sure it was Bowman Gray. And all of a sudden found out when she went out, she had to go on the exchange. She went on the exchange and found out that she could not leave the Commonwealth of Virginia more than one county. Well, that created all kinds of problems because she couldn't keep with her cancer team. Did you have some of those issues as well?
A few of those, but more insurers withdrew from the neighboring counties. So Pierce, Polk, and St. Croix County typically use, which is in the western part of our state, typically use providers in Minnesota, have Minnesota systems. All the Wisconsin systems essentially withdrew from that area, and at least exchange-wise. And so it was primarily a Minnesota company that provided coverage that was licensed in Wisconsin. So they just had fewer choices. They had to go across the border.
Right, and so it's kind of interesting because earlier one of the folks was making a statement on the other side of the aisle and seemed to indicate that whatever plans we were coming up with, they wouldn't work because you couldn't go, you'd have to go back to the other state, I believe she said, to see the doctors. And yet my experience in my district was that problem exists with Obamacare. And it may be one of the things we need to take a look at it fixing, because that one county rule, and I described my district to you, I not only had problems in North Carolina, but one of the hospitals in the area that specializes in children's care in Tennessee serves a big chunk of Southwest Virginia, but because independent cities, Bristol, Virginia is an independent city, Bristol, Tennessee, and the county surrounding it is the one county you could go to, and the hospital is just over the line in the next county. So it was not just the problem in North Carolina with the cancer treatment, it was also problems with people being able to go see the specialists in North Carolina, because I have Bristol, Virginia, Tennessee, whereas you know from the Geico commercial, the line runs right down the middle of the main commercial street there. And then I also have Bluefield, Virginia, which also has Bluefield, West Virginia, and you have to figure out which side of the line you're on there. It's not quite as clear cut as Bristol, Virginia, Tennessee. So a lot of my constituents were impacted by that. And I know that I assume it's not a good idea to change, Dr. Lichtenfield, it's not a good idea to change your doctors midstream, particularly when you're satisfied with the cancer treatment you've been getting. And so it's not a good idea to switch, even though Virginia has some very good medical schools as well. Would that be correct?
Yeah, actually, my son just was interviewed at the University of Virginia, so we respect the medical schools for sure.
Yeah.
Yes, that's correct. I mean, continuity of care is important, how it's constructed, what the rules are, what hospitals are allowed in the network, the location of the network, all of that's important.
Right, and closeness matters too. And in fact, for big parts of my district, they're a lot closer to other states' hospitals than they are to the University of Virginia, which would be the closest to my district. Not to negate MCV, also another fine institution, and others. Let me switch gears, and I apologize, Mr. Weisky, you may not know the answer to this because it was a question for Dr. Holtz-Eakin about continuous coverage requirements, and he had said that pushes providers and plans to invest in preventative and wellness programs to keep patients healthy. And the question would have been, how does this impact the overall market, the overall risk pool? Are you in a position to answer that question? My team says you are, but I don't know.
I think in general, I mean, I think if you're able to keep people in the market and they stay in it and they stay with their insurer, it provides better health outcomes, and potentially over time, it should make the risk pool more representative and overall lower costs.
So similar to what I was talking about before. I see that Mr. Hudson's time is up, and I yield back.
Chair thanks the gentleman and now recognizes